Thank you for joining us for this special community conversation. I'm Julia Ciesla-Hanley, WRFA Public Affairs Director. At this time 2 years ago, we were starting to learn that it wasn't just going to be a 2-week shutdown to flatten the curve in COVID-19 cases of the pandemic. In fact, the first cases of COVID-19 in Chautauqua County were just starting to be diagnosed. A lot has happened in the last 2 years, and since the beginning of the pandemic, according to the New York State tracking data, over 23,000 people in the county have tested positive for COVID-19, and unfortunately, nearly 300 people have died. We've seen variants like Delta and Omicron surge through the population, with another variant, stealth BA2 Omicron, now starting to send cases back up in some areas of the state. But on a more positive note, we also have had vaccines available by the end of 2020, with 2 boosters also approved. The COVID-19 pandemic has now transitioned to being endemic, or in plain speak, the virus, much like the flu, is not going away. We want to take an opportunity to talk to those in healthcare and mental health industries about their experiences the last 2 years and the lessons learned. I first would like to thank you who are tuned to this program on our airways on 107.9 FM, as well as those who are watching online. While we don't have an in-person audience at this event, those watching online are invited to submit questions for our panel using the comment section that I will then ask if time allows. We do ask that you keep your questions brief. Also, I would like to note that this program is being made possible through funding by the Corporation for Public Broadcasting's American Rescue Plan Act Stabilization Grant Fund. So we'll get started with our introductions. I would like to introduce you to our guests tonight. So we have Bree Agate, who is an epidemiologist. She's from the Chautauqua County Department of Health and Human Services. Then we have Steve Cobb. So he's the Executive Director for the Mental Health Association in Chautauqua County. And then to my right, Cecil Miller, who is the Vice President of Operations for UPMC Chautauqua. Welcome, everybody.
Thank you for having us. Thank you. It's good to be here.
So we will get started just immediately with our questions. Bree, we'll start with you. And the question that we'll ask everybody will be, how are you doing today? I mean, it seems a kind of a casual question, but how are things at the health department in Chautauqua County for things in either at your department or in the field right now?
It's kind of a loaded question, isn't it? It's been a 2 years for sure. So we continue to be very busy, regardless of the fact that investigations and contact tracing have kind of been reduced to a minimum. We still have COVID responsibilities that we're responsible for, including testing in the schools. We provide resources for all the school districts in the county to fulfill their mandatory testing for unvaccinated staff. And we also continue to answer any questions that the schools have regarding guidance on COVID-19. We respond to inquiries from the community. And we're also working on our after-action reports. So our preparedness team, we meet on a weekly basis to assess over the course of the last 2 years, what have we done? What have we done well? What can we improve upon? And how can we look toward the future and plan using the knowledge that we've acquired over the last 2 years to plan to do better in the future? What are the things that we can really work on? In addition, we're in the process of developing a wastewater monitoring program for COVID-19 to be able to understand what those levels of COVID-19 are in the community, regardless of whether or not somebody goes to get tested or has any symptoms at all. So we're very proud of that program. We think there's a lot of potential for it. So aside from COVID, we're working on community health assessment and community health improvement plans, and we're also rebuilding all those programs that we had prior to COVID. We're still responsible for during COVID. Some of them we haven't been able to give the attention they deserve. So a great example of that is sexually transmitted infections, and across the nation, across the state, those numbers are on the rise, and now that people are starting to access healthcare more frequently, we're finding that that's true in our community as well. And so we're trying to quantify that issue and develop messages to try to educate the community about sexually transmitted infections.
All right. Thank you very much. Stephen, same question. So how are you today? How are things at the MHA?
Sure. So I think the first thing I want to say is to just let everyone know we're open. I still encounter confusion as to whether we're open and providing services, so we are. One of the things that was interesting for us was that we never stopped providing services during COVID, and we continued to, all through COVID, provide, except for 2 weeks, even our in-person services. We varied them, and we took into account the safety of our staff and anyone who we would encounter, but we were one of the few mental health providers that continued to do that during those early times of the pandemic. And then what happened, we kind of transitioned to a model that there was some virtual stuff and then some in-person stuff. So we have, since just after the first of the year, we've started adding more in-person stuff, both in Jamestown and in Dunkirk. A big part of the services and the supports that we provided were forms of social support for people who were in recovery, inviting people to come together and get connected and develop the supports that support recovery. So we've engaged back in that process of inviting people back and doing that in a safe way for our participants and for our staff. And that's been going pretty good. We're making good progress with it. And I think the other thing that's really at our forefront of our agency and particularly our board is just the health and welfare of our staff. We've really had to focus on that in ways we never did before. You know, being an organization that's kind of based on a peer recovery model, all of us have our own lived recovery experiences. So I think a lot of attention and support has been provided to our staff. How do we keep them healthy? They're our greatest asset. How do you keep them at a point where they can do what they need to do to support the people in our community? So that's kind of the new direction we're looking, and I think we're doing pretty well so far and looking forward to some new ways to support our staff and keep everyone healthy and able to help the people in our community. So,
Thank you.
yeah.
Cecil, at UPMC Chautauqua, obviously, the hospital itself has gone through a lot of changes, but so how are things going today with what has happened with COVID?
Well, it's been interesting, that's for sure. So at the beginning of COVID, you know, our area really wasn't hit that hard. So while we were testing and we were ramping up and we were ready, we weren't seeing the patient volume that many parts of the country were. So, you know, it gave us a little time to prepare. That was probably helpful. But the last 4 months of 2021, I've been there 26 years. It's by far the busiest I've ever seen the hospital. We couldn't transfer people because every hospital was in the same situation. Nursing homes were full. They couldn't take people. It was because of staffing issues a lot of times. So we had days where we were literally boarding 40 or 50 people in our emergency department, which has enough rooms for 28. You know, I give our staff credit. You know, they came in, worked day by day in the same situation, and you know, we did a great job caring for the community as always. We put rooms where there weren't normally rooms in the emergency department. It's just what we did. We doubled up rooms on the floors if we had to. We did what we had to do to take care of patients. Today, as you asked, things are much better. You know, I think all hospitals have seen a little relief from that spike in COVID. Today we had no COVID patients in-house. It's been that way for a couple days for the first time in a long time, so that's great. And I know our sister hospitals, you know, Hammett, Northwest, they're seeing the same thing, so that's great. We've also worked on some great relationships with the nursing homes, and they're taking more patients that maybe didn't meet criteria for insurance, they're taking them now. So it's really been a great community effort, and we're certainly today in a much better place than we were 3 months ago. And I'd tell people, you know, if you need care, I've said it all along, you need to get the care now. Don't wait, don't put it off, because that certainly has been one of the things we've seen from COVID is people put off care, and then when they came in, they were really sick, and we didn't find the things we would have if they had the, you know, primary care or screenings.
So moving on to the next question, and Stephen, I'll start with you. And it's kind of the big question. What did you learn from the pandemic? What did you learn at MHA or even just personally?
Yeah, that's a great question. That was actually one of the easiest ones for me to answer. I think from my perspective as somebody who works in the mental health field, and I think amongst our staff, this was pretty universal. We really realized that people in general just aren't prepared for isolation and crisis and change like we encountered in COVID. And it really made us realize that, that especially from a mental health point of view, it's so easy for us to know what we need to do to take care of ourselves health-wise. Like we know if we go to the gym and we go through these routines, our body is going to be healthier. We know if we eat a good diet, our body is going to be healthier. But few of us know what we should do on a regular basis to take care of our mind, to take care of our mental health. And you know, really being aware of that process of what you do to take care of yourself emotionally and mentally, I don't think we pay attention to that as a society. Historically, we're not comfortable talking about mental health. You know, we've really learned that, at least in the folks who we work with, and the folks who we work with are obviously more susceptible to mental illness, to really begin to talk with them about those wellness techniques and what do you do and how do you take care of yourself mentally? Is it fishing? Is it walks? Is it biking? Is it journaling? And really be creative to help people come up with those ways to take care of themselves. And, you know, I have to say, honestly, even myself personally, when I was in the middle of the pandemic, I had to sit and look at that for myself. I had always assumed I was in a pretty good place with what I did to take care of myself mentally and emotionally, and realized that I wasn't as in as good of a place as I thought I was. So I've really spent a lot of time with that. We've done a lot of work with our staff doing that, and now when we connect with somebody who comes for services, that's one of the first things we ask. You know, what's your routine? What are you doing to address the mental health stuff? So many people come to us and say, I go to the gym every day, which is great, but you know, what are you doing for emotional and mental support? So we've really been aware of that. We've really learned a lot about that. And I think the other thing I learned was that prior, our agency has always had a big embrace of harm reduction and the principles of harm reduction, whether it's on the substance use side, but also on the mental health side. And I think we've embraced those even more during the pandemic, not always just from the point of view of saving a life. You know, we think of that harm reduction technique or practice of naloxone that will save somebody's life who's overdosing. Of course that's important. But harm reduction finds its root in, honestly, a basic love and respect for other people, to meet them where they're at, to understand. I think one of the things we learned during the pandemic was that everybody looks for something to cope with stress. It's not just somebody who has a substance use disorder. It's not somebody who has mental illness. All of us look for that. That's part of human nature. And when we understand that and accept that, the harm reduction approach becomes really easy, because that person, you know, across from us who we're trying to help, and I don't just mean us as mental health providers, I also mean us as neighbors, I also mean us as community members, to take that approach and listen to people, meet them where they're at, and offer support. So those are two things that have become very clear to me personally, and then also us at the MHA.
Ciesla, we'll go to you next. What would you say are things that you learned from the pandemic, either personally or from the hospital side?
You know, the first thing is nurses and our employees in general are incredible. I mean, you think back, we didn't know exactly how this was transmitted. And so we're telling, you know, our people in the ED, somebody's gonna come in with respiratory problems, you need to care for them. And they did. And, you know, it's easy for me, I sit in an office, slap on the N95, you'll be fine. But, you know, these are real situations, and we didn't really know. You know, we knew we wanted to wash our hands, wear a mask, but we didn't know how it was transmitted. And they came to work every day. You know, it was really incredible. The other thing is the depth of the system that I work for, UPMC. it was incredible. I'd be on calls every day with Tom Reed and other hospitals, and every hospital was out of everything, whether it was masks, gloves, and you remember how it was that first 6 months especially. And it was almost embarrassing. We just never had those issues. We always had enough supplies. We had the monoclonal antibodies. We were the first in the area to provide that. It just was never really an issue for us, and that's the depth of a system as large as UPMC. And it was incredible. I remember the Department of Health, one of their mandates was that every hospital have a 90-day supply of PPE in a warehouse that you didn't touch, just in case. So we got a nice letter from the Department of Health saying, if you don't have this 90-day supply by Monday, there would be an X amount of dollar fine per day. So this was on a Friday morning, and we had a supply by Friday night from Pittsburgh. So I don't know a lot of hospitals who could, dig that deep and be able to do that. So the last thing, the collaboration within healthcare, hospitals, Department of Health, everybody, how we work together. We tend to be very siloed before COVID. We did our own thing. We looked at everyone as competition. We didn't necessarily work that well together, I'll admit that. But this forced all of us to work together, and I think ultimately that was a great thing.
Yeah, the whole silo thing, definitely one of the things I noticed changed a great deal when we were going through in any industry with COVID. Bree, I'll finish up on this question with you. What would you say you learned during the pandemic for yourself and within the county health department?
Well, I'll say that as a department, obviously experience is the best teacher. And if you think about the role of the health department, how much more serious could it get than a pandemic, right? And prior to the pandemic, we had to do all these drills and exercises for preparedness every year or every other year. There's something that we have to do. And prior to COVID-19 pandemic, we had done a Hep A exercise, and that was so it was a post-exposure prophylaxis exercise that we did at JCC prior to COVID. And I remember
Can you back up and explain
Sure.
what that is? Because
okay, yeah, sure. So if someone is exposed to a virus, we know that they've been exposed, whether it's by a food handler or in an environment perhaps where there's drug use, or like a homeless shelter. If someone's been exposed to a virus such as hepatitis A. In the case of hepatitis A, post-exposure prophylaxis, which is basically vaccination after you've been exposed, that can help to prevent serious infection and also death. So it's a big deal. And we have to do these exercises periodically just to make sure that we know how to do this. It's the responsibility of the health department to take that on. And at that time, before COVID, it was a lot of work. It was very overwhelming. And throughout COVID, we've really learned a lot about case investigations, contact tracing, and hosting large-scale events to vaccinate people. And during the COVID-19 pandemic, we're also dealing with an outbreak of hepatitis A. And this was about a year into the pandemic, and we're all pretty busy as it is. And here we are having to get into Hep A investigations and to do post-exposure prophylaxis clinics. And it was just fascinating the way that our team was seamlessly able to roll from COVID-19 vaccinations into doing Hep A vaccinations. It was almost nothing because our team had learned so much about how to pull off a large-scale vaccination clinic. So if nothing else, certainly the experience of COVID-19 has been an extraordinary teacher for our department.
Mm-hmm. And I remember that those Hep A clinics were happening at MHA. So we were advertising, okay, if you want to get your COVID vaccine, or if you want to get your Hep A vaccine, go to MHA on these days, and they have it there in other locations. So, wow, yeah, it was one of those things that was kind of like all rolled into one, and definitely was
Right.
Yeah.
Sure, we can do that. We've been doing it for
Right.
however many months.
So, start with the third question. Ciesla, I'll start with you. What would you say were the biggest challenges during the pandemic at the hospital, and how were those addressed?
It was probably the pace of change. We'd receive notice usually on a Friday late in the day of whatever the mandate was for the next week, and we'd have to react. One that I remember well is when hospitals were going to do the first vaccinations. Well, I can tell you, and Bree will agree, we're not set up to do large-scale vaccination. They are. That's what they do. It's not what we do. But that being said, that's what we were called to do, and that's what we did. So you'd get, a vial holds 10 doses of Moderna. So let's say we had enough for exactly 100. Well, early on, it was hard to get vaccine, and you had to be very careful. We didn't want to waste any. And if you did, there was a process, to let the department know. And, you felt a little like you could be in some problems if you wasted a dose. So we'd have a clinic, and we'd have 100 doses, and we'd get to a point where we used 98, and now what are we going to do with these two? And there were only certain people who could receive the vaccine at that point. So, we'd call the county, do you have anybody, who is due for the dose? And, we'd call people and get them down. And we fortunately, in those early days, we never had to waste the dose. But I can tell you, it was trying. I can remember days at 4 o'clock in the afternoon thinking, who are we going to give this to? But we, luckily we found people. And it was just those types of changes that we learned. We're a big organization. We have a lot of employees. UPMC is, almost 100,000 employees. Things don't always move quickly, but we learn to move fast.
Bree, I'm going to come back to you and ask that same question. So what would you say biggest challenges during the pandemic, and how were they addressed?
Yeah, my answer is somewhat similar in that I would say that the biggest frustration was the constantly changing guidance and the mandates or rulings that would come down, and we had no notice at all. In a lot of cases, we would hear about them from local media who were inquiring about the the governor's press release and how we were going to fulfill whatever mandate was coming down at any given moment. And we had absolutely no notice. We didn't have any guidance, and we were expected to do a lot without any notice at all, and that was incredibly frustrating.
Guidance, that was the wrong term.
You're right. It wasn't guidance yet.
It was, yeah, a mandate.
The guidance was to come out, 2 to 3 weeks after the mandate was to be enforced, yes. So that was incredibly frustrating, and the target kept moving, and I recall during these press conferences, call your local health department. They'll know what to do. Call your local health department. And we had no idea what to do. No one, our message was, trust us, come to us, let us help you. And at the same time, we didn't have anything to base our guidance on, because we just found out that that change was happening. And I would say that the last thing that I was thinking about here is a lack of resources. At the beginning of the pandemic, we had almost no resources in terms of funding, in terms of additional staffing support. We couldn't hire any additional people. We were told we couldn't use volunteers. Resources came late. I would say too little, too late, except for I would say that the resources that are being provided now are adequate. They're just not as important as they would have been last year at this time. The money has come through, but when we were starting to do vaccination clinics, we had no idea that we could purchase items and then they would be reimbursed later on. So we didn't have proper signage. We didn't have new, cots or barriers to protect privacy, anything like that. We didn't have any resources to buy those things. In hindsight, the money was coming, but nobody told us.
Millions of dollars.
Absolutely, yeah. And we're not used to spending money, so we're like, what are we supposed to do with this?
Sure. And thinking about when you're talking about, not the guidance, but the mandates, is that, it was one of those, it was almost appointment viewing to watch the governor's update every day, because you never knew what was going to be announced at any given time and what changes. And at the time I was working in government and myself and wondering, well, what are we going to be able to do? What am I going to be able to tell people? That are we going to be shut down for 2 more weeks? Are we going to be able to open up anything? And so knowing that mine was at such a small level, and for a lot of people, but for healthcare industry to be mandated and not have the information to go with that, totally. It was one of the things that was really unbelievable in some ways, but yeah, you did manage it.
Just do your best every day.
Yeah. Stephen?
The best you can.
Oh, yeah, sorry, didn't mean to interrupt you. Yeah. Stephen, we'll go to you. So biggest challenges during the pandemic, and how did you address?
Yeah, I think one of our biggest challenges was really early in on the pandemic. The population who we served, a lot of them are very vulnerable and have a lot of very special needs. And We had a really difficult time connecting with them, but we had the knowledge that they needed help, they needed support, and we just weren't quite sure, how do you get to them, how do you support them? That time when people were just afraid to come out unless it was an absolute emergency, and when you're helping and supporting people who are experiencing mental health symptoms and substance use disorder, you don't want to let things get bad to come out for help. You need that support all through the process. It was really difficult. And the way we kind of got around that initially was we realized that food was an issue for a lot of folks and getting food to folks, and we had had some relationships with the Salvation Army, some contacts, but we were really, they were having a really hard time getting food out into the community also, and they knew that there were people who normally would come for food that weren't coming anymore. So they had names and they had addresses, and we kind of got together and talked and said, well, we know these people need food. And we, from our list, knew that probably these people need food. So we were able to partner with the Salvation Army there for those first couple months, and I had staff there working. So we were able to start making food deliveries for the Salvation Army. And that got us out into the community. We connected with people who the Salvation Army had and folks who were our participants. So with the showing up and bringing food, we were also able to show up and bring access to mental health supports, to addiction supports, and to also provide information to folks as to what services were available in the community, because a lot of people were under the impression that everything had shut down. And while a lot of stuff had shut down, there were ways to access those services. So we were able to really connect with a lot of people that way through food, and to really, I think, serve them in a way we weren't quite sure to, or how we were going to do that initially. So I was really, that wasn't really how we expected to do that, but that those partnerships in the community that we had, at least among the nonprofits in Chautauqua County, somebody already touched on that, but we really connected in ways we've never connected before. So I was really happy with that. And I think, again, I already touched on this, but one of the challenges we had was just making sure our staff were healthy and taking care of themselves. We respond a lot to overdoses in our community. So going out and not having access to some of the same supports we would have had before then really kind of took its toll. I think really, we really learned our greatest asset is our staff. We already knew that, but we learned it in a deeper way. That was one of the big challenges we had to figure out. So.
Yeah, and for as much as I know the folks at MHA, and back then, I was not even aware that you guys had collaborated with the Salvation Army on that project. And yeah, that was something definitely, I knew St. Susan's had closed down, and and I think it eventually started offering to-go bags. But at the same time, people who normally, would have come out to get them were afraid to.
Right.
Yeah, so.
And even St. Susan's, when they did reopen and were passing out to-go, they would let us come over and get a bunch of to-go lunches so that when we were out meeting with people, we could also hand those out. So just these partnerships just sprang up out of nowhere, which in hindsight, they all made sense, but sometimes, sometimes we grow in difficult times. So, and we learn we can do things that we didn't even think of before.
Right.
So.
Right, and so these comments are going to fit well into our next question. But before I go to the next question, just for our viewers and listeners, I want to introduce our panel again. We have Bree Agate, who is an epidemiologist for the County Health Department, and then to her left is Stephen Cobb from the Mental Health Association, Chautauqua County, and then Cecil Miller to my right, who is the Vice President of Operations for UPMC Chautauqua. So once again, thank you for being here on this panel with us to talk about COVID-19 and kind of a 2-year retrospective, but also talking about things today. So going back to the next question, what opportunities, and this is a weird question to me, because pandemics are horrible. Obviously, the effects they have on the community are horrible, but it forced, I think, a lot of people and agencies to do a lot of things. So what opportunities, if you would say there are any, came out of this pandemic? And Cecil, we'll start with you.
Yeah. You know, we certainly had to become more efficient. You know, I don't think it's a surprise to anybody that there's a staffing shortage in healthcare. So we were dealing with that. At the same time, we were dealing with, you know, volumes that we hadn't seen before. So you have to find ways to be more efficient, you know, whether it's with nursing staff, whether it's using nurses' aides in ways you didn't before, whether it's, you know, in housekeeping and maintenance, you know, you name it, every department had to find ways to do more with less. So that was one of the things we learned. You know, the other thing, let's look at my notes, sorry. We were forced to keep patients that we hadn't kept before. So in the past, you know, we may have shipped somebody to Hammett. Well, Hammett was full. They couldn't receive any patients unless, you know, it was really a critical patient that we couldn't keep. So we learned to keep sicker patients at UPMC Chautauqua. We have great doctors, we have great staff. We have a system of 40 hospitals with thousands of doctors that they can use and call and you know, video chat with. And we were able to keep patients that in the past we didn't think we could. And we found out, you know, we have the talent, we have the bench strength, and we're able to keep those kind of patients. So that was what we learned.
Yeah. Going down the line, because Stephen, what were some of the opportunities? You kind of did mention some of them, but what are some other opportunities that you found came out of this pandemic for the MHA?
Yeah, I think just for a second, I want to touch on that partnership of the nonprofits. The United Way of Southern and Northern Chautauqua County really stepped up and organized those community-based organizations to support people in ways that I haven't seen before. So we had regular weekly meetings where we discussed how can we support each other, how can I come over and help you, how can we do this, and it was that really kind of changed a lot of relationships that we have with other community-based organizations, and that's been wonderful and amazing. I think the other thing that has come out of the pandemic, particularly in Chautauqua County, is a new awareness of how we respond to mental health crisis. And not just from our agency, but also a crisis response out in the community with the police or with the crisis response team that Chautauqua County now has. That uses both peers and clinicians to go out in the community and connect with people who are in crisis to, I think one of their first goals is to try to be able to stabilize and support people without taking them to the hospital. And then if we do have to take them to the hospital, a way that probably would be a little bit better to get them into the hospital if that's necessary. So prior to the pandemic, we didn't have crisis response teams in Chautauqua County. Our crisis response teams were our fire departments and our volunteer fire departments, and then the police would show up. So really, we're in the infancy stages of this and figuring it out, but I'm really optimistic that within the next couple of years, we're gonna see something that we can, as a county, really be proud of, and will really serve our people in ways that's much better for them. Then a lot of times people in crisis don't need to end up in the hospital emergency room. We're able to support them in ways at their home, which might be better than taking them to the hospital, and that's a good thing. That's good for people, and that's good for Cecil and the hospital too. So, yeah.
Bree, so same question. So what opportunities would you say came out of this?
So I think that in the past, a lot of people maybe didn't even know what public health was. And I'll say that now I feel that public health is in the forefront. And so because of that, we've gained more attention in terms of what the gaps are and what the needs are for the community and our public health needs. And we've had more funding opportunities that we had in the past. So that's certainly a wonderful opportunity. And as I already mentioned, experience being the greatest teacher for COVID, I mean, we've been able to learn so much throughout over the course of the last 2 years. Additionally, technology. I mean, we had access to certain technologies in the past, but we never really had to use them. we still had the opportunity to see each other in person, but the need to socially distance really forced us to use Zoom and Skype and Microsoft Teams and these tools that are really, really powerful that we just weren't fully taking advantage of. And so we're able to connect with partners across the state and the nation a little more seamlessly than we were in the past, and even saving resources locally to host meetings online. And another technology that I kind of mentioned before is the wastewater monitoring. And it's currently being used for COVID-19 to understand what those levels of COVID-19 are in the community, but there's the option to test for other infectious diseases as well as other biomarkers in the community that I think would be really helpful for our healthcare community in general. You know, for providers in the community to know that RSV is on the rise or influenza is on the rise, and these are the things I should test for. This is how I should treat my patient, and also for the community at large to understand, you know, for those who might be more vulnerable or have many underlying conditions, they can make an educated decision on what they're going to do, where they're going to go, whether or not they're going to wear a mask. They can really make an informed decision about those things, and that's a technology that, had COVID not come along, we probably never would have explored.
Yeah, and from someone who's in an information business, I've definitely appreciated the addition of the wastewater testing results that have been added to the county health department's COVID-19 page, and also the link to where you could look at even results for state for the 40 some, I think, communities who are doing those testings, because it's just like people want information and be able to see that graph now and see how it's gone up and now down again, fortunately, and at least for last week, to kind of get a sense for where are we, because the at-home tests, people aren't reporting them, so trying to get a sense for, is it safe out there? And it's like, well, okay, this is just one more piece of information. And I have to ask, it wasn't on my list of questions, I said, but how many of us use Zoom before COVID-19? And I'm going to say, raise your hand if you use Zoom. And for people who are listening, I don't think any of us are raising our hands. And I won't ask you the question of how many hours per week you figure you spent on Zoom or Microsoft Teams, because I happen to know it's probably more hours than you ever would want to think. But no, I mean, yeah, the technology that came out of this, from an information standpoint, access to information, from, not outside of healthcare, for me, being able to watch government meetings or meetings being held, over Zoom and not having to be there in person, or even people not having to be together in person, is such a great resource. So a lot of things, I could go on my own whole topic of things I learned during the pandemic, but yes, there really were some things that came out of it. Plus the funding, I'm sure. The funding, that's one thing I didn't think to ask, was just how much the funding has affected what you are able to do. And maybe we'll ask that at the end if we have time. So in terms of accessing healthcare, in Chautauqua County, we are a rural county, but what is the message that you have for folks in our community about accessing healthcare, especially, with still, it is a pandemic, still an endemic, and there are other issues. And so Bree, we're gonna start with you again, because you did mention this, that you're doing an assessment. And so if we could maybe elaborate on that, and also the message you would have for folks.
Sure. So in terms of the community health assessment, that's an exercise that we do every 3 years in partnership with our local hospitals and community partners to identify what the health needs are in the community. And we take a look at the secondary data to understand, what diseases are more common in our community and how do we fare compared to the state and the nation. And one of those is healthcare, and health insurance status. People seeking out preventative care. So like, for example, cancer screenings would be a great example. So we will be taking a look at that, and I don't have any of that information at my fingertips yet. But one of my key messages for the community, or what I would urge individuals locally to do, is really to seek health information from people who are medically trained. Rather than friends on social media or your preferred politician, and to start with questions rather than conclusions, and to keep your mind open. I think over the course of the last 2 years, we've spent a lot of time on our phones, online, just reading everybody's opinions and comments, and it really, I think, shapes the way we think, the way we talk, and the way we interact with others. And I think we need to kind of take take a step back as a community and really trust those who have been trained in whatever the topic of the day is. And in the case of healthcare, I would say to take advantage of the great resources that we have in healthcare and those individuals who have spent a lot of time learning, the best information on these topics and really take advantage of them. So whether you're accessing them in person, virtually, just make sure that those individuals that you're reaching out to are appropriately trained to make your own conclusions.
Mm-hmm. And given that we mentioned a couple of times that you're an epidemiologist, and just remind listeners and viewers, what is an epidemiologist?
So epidemiology is the study of disease in communities, as well as the determinants of disease in communities. So what are the levels of heart disease? What are the levels of COVID-19, other infectious diseases, as well as the behaviors that contribute to them? So looking at obesity, nutrition, physical activity, all those sorts of things really play into epidemiology itself, as it's the study of those things. So an epidemiologist, there's actually a broad array of things that epidemiologists do, and obviously during COVID-19, the greatest thing that's been highlighted is case investigations for infectious diseases, but it's really using data science to understand your community and what impacts our health, and looking kind of holistically at a community and not just at one individual indicator, but the community at large, to see what are the things that impact us individually and as a society.
Mm-hmm. And I wanted to ask that question because when you talk about seeking out people who are trained and the background knowledge about, when it comes to questions about healthcare, that's why we invited you on this program. This is one of the examples. But moving along, Stephen, same question. Mm-hmm. Obviously, healthcare, mental health is healthcare. Mm-hmm. What are the message you have for folks looking at accessing services of this sort?
Well, I think, first of all, I would say just here in the county, all of our mental health providers are open, and all of them are seeing patients. So I think it's important to just make sure everyone knows that. And I think the other thing I would say is that reach out and ask for help. Something as simple as that. We're so adverse to talking about mental health, and we're afraid to talk about mental health, I think, for a lot of us. So to really reach out to folks and ask for help. But sometimes that support for something on the mental health side might first come from your neighbor or a family member. It can start right there. And then the next step might be to reach out to a professional for help. I think the other thing we found out in the mental health field was that, and I had a hard time imagining how this would work. How do you deliver mental health services through Zoom? How do you deliver mental health services through a virtual appointment? And you know what? It actually works pretty good. I think there are times where you might want to be face-to-face with somebody, but I think there are times where Zoom or a virtual appointment works really well. So don't be afraid to try that for mental health. And I think the other thing I want to say is I think all of our clinics in Chautauqua County, I know that they all do, they all now have peer support services in the clinic. So UPMC does, TLC does, and Chautauqua County Mental Health does at both their clinics. So, and that's a wonderful part of the mental health system that is everywhere now. So in addition to those clinical support services, which are often essential, there's also that peer support thing that is available to anyone in any of these clinics. So, and all those services are covered by insurance too. So that's a good thing. So, you have those couple levels of support that you can now have in our clinic. So take advantage of those. Yeah.
Yeah. Ciesla, what would you say for messaging for people who are looking at accessing healthcare? Obviously, people, if they're coming to the hospital, usually it's not always planned, but sometimes, for the services offered, there it is.
Yeah, this one was easy for me. It's safe to come to the hospital. It's safe to go to your doctor. It's safe to go to get your colonoscopy. It's safe to go get your mammogram. People have put these off. I mean, we're seeing, backlogs because we know, we call people at the 5-year mark and you're due for colonoscopy, and people weren't coming. And we saw it across the board. People were scared. They didn't know. They thought if they went to the hospital, they were, could be exposed. It's just not the case. You're safe. If you need care, please get it. Get your screenings. I can't say it enough. We're just seeing sicker people. People put things off, and unfortunately, then you get to a point where it would have been treatable had you been screened earlier, and now it's not as treatable. So, that's the point I want to get across. It is safe to access health care.
Mm-hmm. Under I don't know if it was federal guidelines or state guidelines, is there still masking required in healthcare facilities?
There is. And I don't want to speak for our system, but, I would see UPMC probably still masking even if it wasn't required. I think you'll see it, especially in patient care areas, for a while. It's just the right thing to do for many reasons. If we've learned anything, we know that masking has worked.
Mm-hmm. Yeah, on a more casual note, I notice it really helps with my allergies. And it's springtime. So moving on to, this will be one of the last questions we ask before we open up the conversation to audience questions. Again, if you are watching us either on YouTube or our Facebook stream, or if you are listening on the radio, you can submit questions for our audience or for our panelists tonight. You can leave those in the comment section on the YouTube stream or on the Facebook stream, and those will be delivered to me. And just again, we ask people that if you do have questions, to keep them brief. So, starting with the last question I have at the moment, and Ciesla, I'm going to start with you again, just like so. How do you handle those who are in opposition to guidance or the information that you've put out during the pandemic?
I guess, providing the information is the first step. Our local media has done a great job covering the UPMC news conferences that they had very frequently. Don Yulee was in the paper, from Pittsburgh very often. So getting the word out and really, listening to the scientists and the doctors, that's important. It's not up to us as a hospital or a system to debate people. We provide the same care to somebody who's vaccinated, to somebody who chooses not to be vaccinated. We treat everyone with the same dignity and respect, whether they're vaccinated or not vaccinated, whether they choose to wear a mask or not to. That's our mission. That's what we do. We're not going to provide different care to different people. I can tell you, one of the ED doctors, I've heard him tell the story many times. A patient will come in with COVID symptoms, be COVID positive, and he said, I can tell whether or not they've been vaccinated, even though I don't know for sure, just by the symptoms, how severe they are, how sick they are. And we treat both. We treat them the same. But you can look at all the evidence you want, but I hear those stories every day, and I think it's indisputable when you talk to somebody who is on the front line, sees it every day. And the other thing he always tells people, he's never treated anybody in the ED yet that came in because they got the vaccine and had some reaction, or so that's real life. That's that's not me reading it on Facebook. That's the real story.
Bree, I'm going to ask the same question. So, and it's, when it comes to county government, there's been a lot of very frontline comments made at county legislature meetings by the public. How do you handle those who are in opposition to the guidance, the information that the county health department's been putting out?
Yeah, I don't know that I have a great answer for that, but I think I would, echo what Ciesla said, is you start with the information, right? Like the best information at any given time. And we know over the course of the last 2 years that the information has changed many times, but science is a process and we learn as we go. And with this being a new virus, what we know about it is going to change over time. And I think that's really hard for people, and it's hard for us as organizations to adjust to that. So truly it's really trusting or understanding what the most recent information is and sharing it as clearly as you can. And continuing to try to explain that that message might change over time because we continue to learn more. But I think that also over the last 2 years is that we know that there's a problem with trust, right? And we need to focus on that being the issue. We might have the best information that we can possibly have, but whether or not it's right doesn't matter if the person on the other end of the line doesn't trust you. And so we need to work on building trust in the community, among each other as professionals, as organizations, and as community members. And if we can do that, then we can start to heal from this time, which has been incredibly challenging for all of us.
Yes. Stephen, same question.
Yeah.
How do you handle those who may not be quite on board with the information coming out?
Yeah, I think I would echo what I've heard from both of my friends here. First, with dignity and respect. At the MHA, we fall under Office of Mental Health guidelines, so we are still masking there. So we get a lot of kickback from that now at this point, because we don't look like a medical facility. We don't look like a medical facility at all. So, and again, it's with dignity and respect. And I think people, at least with us as it relates to masking, I'm thinking of that because honestly, that was on my mind today. We had an opportunity to deal with that. And I will say that when you approach people with dignity and respect, most of the time, you get dignity and respect back. And I can't say that's 100% true, but for us, from our point of view, it has to be 100% true when we're dealing with those we serve in the community. And I also think, too, you know, and I think I learned this from being a mental health provider, is to always listen. You know, I have very strong ideas about what I know is right, about what works and what doesn't work with COVID, and that's really no different than somebody else who disagrees with me. But that one of the things that might allow us to find a place to connect is by listening. So even from my point of view, which is my point of view is pretty rooted in science and what I think and what I believe. You know, to listen to somebody who doesn't see it the same way, who has a different set of knowledge or facts that they're working from, and to treat that with respect. That's always when the situation turns out the best, especially when you're dealing with somebody, you know, specifically somebody who's in a mental health crisis. And I guess I'll be honest with you, sometimes I've just had to learn, okay, you're not going to put on your mask, but I'm still going to try to help you. And that's okay. And that's when it's important, you know, to keep all of us, my staff, safe. So if we have somebody there who's not being safe, we can deal with them in a safe way. And that's important because people who are in mental health crisis are often not in a safe place with other health issues, whether it's COVID or something like that. So I don't think we ever walked away from anyone there. We had a couple people who walked in who were in mental health crisis, and then we quickly realized they were probably COVID positive too. And while I won't say none of us weren't, you know, we didn't stop and think, am I safe? But when we thought about that, we realized we were safe, because we had taken the precautions that we needed to take. We were vaccinated, we were wearing masks, and we were sanitizing all over the place. And it's you know, even when you disagree, and even when you vehemently disagree, we're still further ahead if we're respectful of each other. So, and then you figure out how to make it work. So, yeah.
Yeah. One of the things, we mentioned science a lot, and I had a flashback thinking about a majority of people going through school and, you know, taking science classes, taking history and education. I mean, those are classes where the knowledge you learn then, most of the time you anticipate it's going to stay the same. But really, when it comes to everything, there are advances being made. But if you're not following those fields, you don't necessarily see it. So to have things so fluid in the scientific field, and how fast things can change, that is not always familiar for people, and change is uncomfortable to begin with. And then you have so many changes during the pandemic that I can understand why people are resistant even still to what they're hearing, even though it's factual, even though it's based in science-based evidence and everything. So I can empathize in that sense, even though it's difficult when we were going through it and still going through it. Okay, well, we heard this is an issue, but now we know this, we want to treat it this way, or we've moved our thought process to this is how we're going to monitor, and it's people want to grab onto something and hold so tight, and I think that's where we end up going to. So be very quick. We have time for like one question, and I mentioned something about. And Bree, you brought this up, this fact that when you were dealing with it, you didn't know all this money was coming. So in terms of funding, I imagine that all three of your agencies have benefited in some way from some of the funding coming down from the feds or from other agencies or places. And Bree, if we can start with you, what are some of the things you've been able to do now that you couldn't have done 2 years ago with some of the funding you've gotten?
So there's actually a new program that we're currently developing. It's not quite to the point where we're pushing out to the public so much, but we're going to have funding to support fellows to work in public health. And the goal of that is really to build public health infrastructure and to build capacity in public health and encourage people who maybe weren't even necessarily pursuing public health as a career path to educate them and support them and provide them with real life experience in public health, really boots on the ground kind of efforts. And in the past, we've had interns here and there, but we've never been able to pay them. It's never been a paid position necessarily. There's been a couple that were because of special circumstances, but we've never had this kind of opportunity before. And so moving forward over the course of the next year, we're going to have an opportunity to bring on up to 12 different people full-time working in the field on different public health efforts that have been impacted by COVID-19. So that's just one example of funding that's been supporting us and will be growing over the next year.
Great. Stephen, moving quickly to you because we are running out of time, but I want to get to everyone. Have you received any funding that's been allowed you to do anything that you couldn't have done before?
Yeah, we have. We've actually received funding to be able to provide retention bonuses to peers. So just as there's a healthcare worker shortage everywhere, it is to some extent in our field too. And we've also, I think one thing that's come out of us, because a lot of times peers are at the front line of responding, there's really been a greater embrace of us as medical professionals. So and New York State's really recognized that and increased some funding so that we're able to pay a living wage and to support people who are peer specialists in a professional way. So,
Wow.
yeah.
And Cecil, has UPMC been able to see any benefit from financially, at least, in terms of programs you've been able to provide?
Yeah, certainly, it's the biggest effect we had was when we had stopped doing non-essential surgeries, which I laugh at that term because, if you need a knee replacement, I don't think you would say it's not essential or elective. But that being said, we had months where we had to shut down our surgery, and that certainly is revenue generating for us. So I think what the funds did, it helped us keep everything open. We didn't have to limit any service at all. We could keep every staff member working. Everybody was paid the entire time, whether we had work for them or not. So I think that was the important thing.
Wow. Well, thank you. For anybody who's looking for more information about COVID-19, you can visit the Chautauqua County Government's website at chqgov.com, where they have links on the front page to the health department's pages. Also visit mhachautauqua.org to learn more about what the Mental Health Association in Chautauqua County has to offer. I want to thank each of you again for participating in this panel tonight. And also thank you to our audience. You will be able to view this presentation online for free on our Facebook page, YouTube channel, and on WRFALP.com. On behalf of the WRFA, the Reg Lene Center for the Arts team, Ed Tomasini and crew, thank you for being with us tonight here on WRFA.